As the founder and CEO of Collaborating Docs, the premier collaborating physician matchmaking service for nurse practitioners, I often receive inquiries regarding the ability to prescribe Schedule II medications. It's essential that collaborative relationships not only provide value to nurse practitioners, but also remain fully compliant with regulations. I'm Dr. Annie DiPasquale, and I want to address one of the most common questions I encounter. Will my collaborating physician allow me to prescribe Schedule II medications? I'd like to break this down into two parts. So the first part is, can a nurse practitioner prescribe Schedule II medications? This depends truly on two very clear things. Number one, the nurse practitioner's licensure, and number two, state regulations. All medical providers must have a DEA license to prescribe controlled substances. And as of this recording, there are several states that do not allow nurse practitioners to prescribe Schedule II medications. So it's crucial, if you're a nurse practitioner, to understand the specific things you are allowed to do in your state. The second part of this question is, can a collaborating physician prescribe medications for a nurse practitioner's patients? For this, there's an unequivocal no. A collaborating physician cannot prescribe medications for a nurse practitioner's patients. Prescribing any medicine, whether it's controlled or not, requires a direct care relationship. Since the collaborating physician does not directly treat the nurse practitioner's patients, they cannot legally prescribe for them. Some practitioners might recall times when their collaborators sent in prescriptions on their behalf, or maybe pre-signed prescription pads, but this practice has always been against regulations. It's imperative to adhere to state regulations to safeguard your licensure and your professional career. Risking your ability to practice medicine is never advisable. For nurse practitioners concerned about managing patient expectations when they cannot prescribe certain medications, the recommended approach is to refer the patients to a local provider who can legally fulfill their prescription requests. Patients generally understand when there are limitations, and they will appreciate your transparency. If you observe colleagues who seem to bypass these regulations, just remember that compliance is paramount. Just because others might be taking shortcuts does not justify the practice. State regulations are in place to ensure professional integrity and public safety. So in summary, controlled medication prescribing within collaborative agreements must adhere very strictly to the state laws. Collaborating Docs is dedicated to matching nurse practitioners with physicians who uphold compliance and integrity. Our goal is to ensure that nurse practitioners can prescribe to the full extent permitted by their licensure and state regulations. Should state laws prohibit the prescribing of controlled II medications by the nurse practitioner, neither the nurse practitioner nor the collaborating physician can legally prescribe these medications for the patients of the NP. So in this case, you'd want to refer such patients to an appropriate provider as the best course of action. If you're a nurse practitioner seeking a compliant and ethical collaborating physician, we are here to assist you.